All right, this is the field project for counseling 538 psychopathology. My name is Cintron, and I will be talking a little bit about adjustment disorders within the military. My declaration, I declare that this field experience project is original and not in any other publication. References will be displayed at the end of the presentation. This is for class purpose only and is for grading criteria for counseling 530A Dr. Sanders at Regent University. All right, I was privileged to visit the local mental health facility at Yokota Air Base in Japan, where I currently live. It is called the 374 Mental Behavioral Health Clinic, or the MHC. I had the opportunity to interview Captain Brandon Smith, a clinical psychologist with a PhD. Captain Smith mentioned that Dakota's most common cases from military personnel active duty members and their families is adjustment disorders. The DSM-5-TR recognizes that AD or adjustment disorders behavioral symptoms are stress, anxiety, sadness, and or hopelessness. Dr. Morgan explained how adjustment disorders has been the most commonly diagnosed mental health disorders among our service members since day one in boot camp. Armed Forces Civilian Division data states that adjustment disorders cover 30.8% of the cases. Here in Yokota, mental health practitioners use a triage or a victory form. Technicians use these 4 pages interview to help patients before the appointment with the clinical psychologist. It gives them like a map, a roadmap of where the patient is, and it gives them information to add additional resources. Captain Smith described that the first intake is always one-on-one with the psychologist. However, on the second visit, the psychologist offered 2 alternatives with the patient. They either go and take 12 sessions one-on-one or 6 group therapy sessions. These alternatives are not planned between the psychologist and the client, differentiating them from counselors. The ACA Code of Ethics 8.1.c, the counseling plans, guide us on planning accordingly with the clients to ensure growth and accountability, and revising regularly to ensure the therapy effectiveness and the client's freedom. Captain Smith described that the 374 MHC is famous for running group therapy sessions. Feedback from patients are always positive. They said that it helped them to increase cohesion between the active duty members. They said that creates a sense of community and overall openness to talk about their problem, which is the number one problem in active duty members. They don't like to talk about their problems. Standard diagnostic criteria are stress, anxiety, separation, and adaptation. It meets the criteria of being present for more than 3 months due to the relocation, as this is a overseas duty station. I asked Captain Smith for any directive or Christian integration with the treatment plan. He openly explains that if the member expressed the need to integrate any spiritual needs, the plan is adapted for the chaplain to either be with the psychologist or to take over the case, since they are trained in religious studies, theology, and pastoral counseling. The consideration for Christian integration in treatment here has value. The integration of psycho-spiritual maturity may help service members bring to life the healing they are looking for, enhancing their relationship and improving the attachment dependency. Wilder described in their research that a Christian-centered holistic growth of spiritual and psychological models may promote discipline to create quality attachment, perhaps by practicing the spiritual psychology and integrating reality therapy within the groups sessions in Dakota mental health clinic, the result of building caring, loving, respectful individuals may increase, reducing the stigma and the isolation. Building that attachment with God or a spiritual belief may also improve the relationship with oneself. Currently, Yucata's mental health clinicians are working towards creating a one community, utilizing group sessions as key for service members to help each other adapt to what will be their home for the next 3 to 4 years. Walter also described how these quality relationships and the integration of spiritual prayer may promote healthy adult attachment in family groups and community, which is what the clinic is trying to work towards improving in here. All right, I hope this is my references list, and I hope this is good.